Now let's take a look now at mental health in Singapore. Suicide deaths for 2023 have dipped across all age groups for the first time. Latest annual statistics from the Samaritans of Singapore show 322 suicide deaths last year, and that is the lowest since 2000 and about a third fewer than 2022. Other key findings in the report include a suicide death rate of around 6 per 100,000 Singaporean residents. Almost 7 in 10 are males, while the number of youths is down by over 30% compared with the previous year. SOS says the decline in suicide deaths is a testament to the collective suicide prevention efforts by various communities and stakeholders. The social service agency says it will scale up its community outreach through various programs and training. That is to ensure everyone has access to the support they need. Singapore residents can now offer their views on suicide and its impact in a new whole-of-society public consultation on suicide prevention. Led by ground-up group SG Mental Health Matters, Project Hayat, or Live in Malay, will use the data from this research to develop a national suicide prevention strategy. Now, for more on this, I'm now joined by Anthea Ong. She is co-lead of Project Hayat and SG Mental Health Matters and a former nominated Member of Parliament. Ms. Ong, welcome to the program. Now, so the public consultation is said to be the first of its kind. What does the public consultation hope to achieve? Why do we need such a consultation now?
Thank you for having me, Syahida. Very happy to be here. I think it's absolutely encouraging to see the significant drop in suicide rate, as you had shared earlier with your viewers. I do think still that we need to know what contributed to it, what interventions have worked, and how do we do more of the right things that we have been doing that has led to the drop in suicide rates towards a zero suicide society. So this public consultation really is part of a larger research project that looks to dive deeper into suicide prevention in Singapore in order to develop a national suicide prevention strategy through focus group discussions, as well as interviews with different stakeholders across international systems and countries as well. And I think really what we are hoping to achieve here is to have more of suicide prevention efforts that are based from research, from evidence, and we really wish in this consultation to invite and include Singaporeans and residents to offer their perspectives, concerns, and experiences with suicide and its impact on family, friends, and communities.
So, Ms. Ong, the public survey will open on 19th of July, as we understand. Who are the stakeholders that Project Hayat hopes to reach out to? What kind of data are you hoping to find from them?
I wouldn't really try to preempt based on your second question of what we are hoping to find. The stakeholders we are looking for, really, it's for everyone, because in the focus group discussions that's part of the research project led by NUS, Salisbury Hawk School of Public Health, as well as OP, that would already cover certain focus groups that we have identified, vulnerable groups as well, high-risk groups, obviously stakeholders like first responders, media, educators, youth, employers. So these are already being identified, and focus group discussions are underway as we speak. But in terms of this whole of society open public consultation, really we invite all Singaporeans and residents alike to come forward to share your learnings, your views, and mostly your experiences and your lived realities, because what we hope to do with the consultation is to also make sure that the strategy that we are developing with the research is one that is inclusive of all Singaporeans and residents. That is one that can be co-owned by all. And that really, as you mentioned earlier, is a whole of society effort that is the only way towards reducing and hopefully removing suicide completely.
Yeah, and you are driving this project, but how does it differ from or add to existing efforts on suicide prevention in Singapore, Ms. Ong?
Yeah, it's a great question, Syahida. I think this effort is different in the sense that it's very focused on research and then making this research publicly available. Because to craft an effective strategy, it is crucial to research, discuss, and understand suicide, and more importantly, the complex issues surrounding this phenomenon. So, this suicide prevention research project that we're doing that leads to a national suicide prevention strategy recommendation that we hope to put forth will help direct community providers, schools, workplaces, and public agencies to plan services more successfully and meaningfully. And I think this suicide prevention data, as I said, will be shared and made publicly available. So it's really going to help us understand suicide and move us all forward together in understanding what to do to prevent this.
And earlier you also talked about working with various countries. Interviews have already started with private and public agencies across countries like the US, Australia, New Zealand, and even South Korea. How important do you think are such cross-national collaborations for such a study like this?
I think it's very important in the sense of learning from each other, and particularly with these countries that have already established either a national office like New Zealand and Australia in suicide prevention. And I understand that in Australia, suicide prevention sits under the Prime Minister's office, or these countries already have an established national suicide prevention strategy that really then helps to galvanize, a more sort of coordinated approach to suicide prevention and community efforts. And what we've learned from these interviews is the initial stage. The interviews are still going on. But what we've gleaned initially is they have all shared that data on suicide is crucial for suicide prevention efforts. So that's what we're really trying to do with Project Hayat. And data is also best derived from coordinated efforts across multiple stakeholder groups and ministries, which is also what we're doing in the way we have formed the work group, as well as also the focus group discussions that we're having. And another interesting learning so far in this initial phase is that having a top-down 5 to 10-year action plan really helps to mobilize multi-sectoral collaborations, again, to minimize suicide.
Ms. Ong, we appreciate your insights and thank you very much for speaking with us. That was Anthea Ong, co-lead of Project Hayat and SG Mental Health Matters and former nominated member of Parliament.